The progression of the system was really one of understanding what it's capable of first. So we started on a more simple use case, which was staff workflow, really understanding how does it function, how accurate is it, what can we derive from it, and then looking at where's the best place to apply it. So we started with staff and really started to evolve our thinking around where do we really need to make an impact financially for the organization to really show value of such a system. Obviously, when you have to pay for a system, you also want the ROI. So OR made sense in terms of a space where we were having capacity constraints and issues around we need to build out, but didn't necessarily know what that meant if we weren't utilizing it fully, or where were there opportunities to really expand on the space we already have versus spending, X dollars to build out a new OR space. So it made sense to try it there and really look at what are our two entry points. It's OR and ER. So how do we apply this technology in a way that can fix two very big challenges in healthcare overall, not just for our system, but for every healthcare system, and apply it in a way that gives the physicians and clinicians a tool that they feel comfortable to use daily to really enhance their work. So we're achieving employee engagement at the same time of value for our customers, as well as ideally saving the hospital costs so that we can extend that cost savings to our customers. So one of the things that we looked to achieve in applying the patient flow solution was really to understand how we leverage real-time data and information in our everyday processes and operations. It's something that we have a ton of data available, but not necessarily in the fashion of real-time decision-making tools. So how do we leverage a real-time solution and put it in our most expensive space, which is the OR, where you have a ton of variability and movement, and really start to learn and understand what that value back is, what that value proposition of such a system into that place of ridiculous cost and time and expense and patient safety and all these different factors that are influenced around how we make money as a business, how we treat our patients the safest and get the best outcomes. How do we apply that real-time technology in a space that's going to ideally give us the value that we're looking for? So the patient flow solution is really a technology that allows you to monitor the movement and activity around the patient care process, wherever you apply it. So we applied it, for example, first here in a surgical unit and in the OR. So we were able to leverage the way they designed it is to really, one, watch just the movement at a kind of a generic basic level, is watch and understand the movement of a patient through a process. But then the cool part in the back end of it is that is real-time dashboards that all of the key stakeholders and players in that care process can monitor and be a part of, so that they've got proactive downstream, upstream movement and understanding around what's going on with that patient, so that they can eliminate phone calls and use that system to be able to really interact with each other and make the right decisions for the next step and process of care for that patient. At the simplest, I think, function, it's providing an actionable, usable dashboard. It's not just your typical where you just look at something and see what's going on. You can use that dashboard to make information real time to save you time, one, and to help provide a better care process throughout your facility for your patient. So that's kind of the generic, I think, way to say it. It's so much more than that, but at the basic level, it's providing you that real-time decision-making tool. The patient flow aspect is really what it's driving for us so far, is seeing the ability to open up the communication between units that were before siloed and disconnected has allowed for time to be saved in the movement of patients. For example, the PACU, once they go to the post-anesthesia care unit after surgery, there's a critical time there that they have to meet criteria so that they can go to the unit. Once that occurs, there could be any number of variables and gaps that are created that delay a patient getting to their unit where they can get more comfortable, their family can come and visit them. And by applying systems real time like this, what we've seen is, one, is that the caregivers on the unit side that are going to receive that patient are now proactively pulling that patient to the unit, versus before they were blinded. They didn't know where they were in the process. They didn't know, maybe they're still in surgery, maybe they're in PACU, they didn't know, without numerous phone calls that were very distracting to their current patients or workflow. So now they have a system they can walk by and see immediately, my patient is now in PACU, they've been there 30 minutes. I know it typically takes an hour for them to be ready to come to the unit, so I've got about 30 minutes to prep and get ready for them, or let me start calling and giving report, or whatever those activities are, so that we really create an efficiency in the process that was lost before because there wasn't that open communication platform to provide that visibility into both worlds and really break down those silos that were occurring.